He was a lot smaller than the doctor was anticipating. Wasn't concerned at the time. I didn't think it was a big deal. We would take Mason to his pediatrician for his weight checks, and he started to lose weight and he stopped growing, and that's when the red flags came, and that's when his pediatrician started to get really concerned.
He's not getting nutrition. I mean, he's not getting the caloric intake, he's not getting, vitamins and nutrients, and, his organs aren't, we don't know if he's growing inside or not.
We were referred to a specialist at that point, and that's where he was determined that he was failure to thrive. We took all the doctor's suggestions and we tried all these different techniques. We tried formulas, nothing was working. And so at that point, the GI recommended that he get a G-tube placed. I took that personally, that I was failing at raising my child. It was making him sick. So he was vomiting. He was constantly vomiting after every time that we would feed him. It would make him so sick.
And this went on for over 3 years. He had the tube. I would stay awake to see if he was, okay, if he was vomiting.
Seeing your child laying in bed in vomit was heartbreaking.
Pediatric feeding disorder happens when a child is not meeting age-appropriate feeding milestones that then might lead to developmental delays, lack of growth, disability in cognitive function, social emotional development, and their overall well-being. Feeding Matters is dedicated to advancing the field of pediatric feeding disorders by accelerating identification, igniting research, and promoting collaborative care for children and their families.
Our GI actually recommended a special feeding therapy program for Mason. He didn't know much about it, and he didn't even know if Mason would be a right fit for it, but he thought we would give it a shot. He actually successfully completed it, and the GI specialist that headed that program, she felt that he was ready and that he could have his G-tube removed. He learned to eat again, and he learned that food maybe is not so scary, and he opened up to the willingness to actually want to try foods and enjoy them. And so at that point, that's when I saw a change in Mason, that he started to ask for food. He started to want food.
Feeding Matters has been able to give us hope, especially my wife Sandra, and has provided a lot of support for us.
If your child was suffering and in pain at every single meal, and you feel so very helpless as a parent, that's just not okay. We've got to do a better job, and we're proud that Feeding Matters is leading the way.
I think meal times are more enjoyable now. We sit down as a family and we all eat the same thing, and it's actually a happy time for us now. We look forward to it.